My name is Lindsay Hellwig. I'm a board certified nurse practitioner, and today we will be talking about restless leg syndrome and neuropathy in relation to venous disease. Secondary restless leg syndrome is normally caused by some underlying disease process. There's several different things that can cause it. It can be caused by venous disease. It can be caused by low iron levels, pregnancy, some certain medications can cause it. Primary restless leg syndrome is caused more from genetic factors and it has no underlying diagnosable disease process that can be treated. Neuropathy can be a secondary symptom to restless leg syndrome. It can be a secondary symptom to, most notably, what we think of diabetes and also venous disease. As you look at the body's anatomy, those vessels and veins in your leg follow down the pathway with the nerves and the peripheral arteries. So as those valves become diseased, they can start to stretch those veins, which can also put pressure on the nerves. It can tug and pull on the nerves, and also those veins can leak proteins into the surrounding tissue that can irritate and affect the nerves, essentially causing your neuropathy symptoms. Probably about a quarter of patients who have restless leg syndrome have an underlying vascular disease, and within that population, about 98% of them have improvement once that vascular disease is treated. If your restless legs are being caused by venous disease, depending on what your screening outcomes are, they would get a plan specific for you for treatment of those veins. There are different types of venous treatments, one being an ablation where they go in and they use a radio frequency or a heat to close off the vessel. There's also different medications like polydocanol and sotradecol that we can inject into the veins to close them off as well. I would encourage you, if you have any type of symptoms of restless leg syndrome, to seek further workup because it can be an underlying disease process that does have treatment that can potentially improve your symptoms greatly without the use of medications that can have bad side effects. If you feel like you are having symptoms of restless leg syndrome or venous disease, please head over to our website to fill out our screening quiz to learn more about the information.